Welcome to the Registry Insider. I'm Bill Seifert, CEO and Executive Director for the National Registry of EMTs and the host for this podcast episode. During today's episode, I have Dr. Panchal joining me from our research team here at the National Registry to talk about an important subject that's the subject of many conversations, many presentations at conferences. It's the challenges facing the EMS workforce. So, Ash, thanks for joining me for today's episode. And by the way, for our normal listeners or viewers, the format's going to be a little bit different today. It's going to be more of a presentation style rather than conversational, but certainly we'll try and have a conversation along the way. So, Ash, thanks for joining me.
No, it's my pleasure. I think one of the biggest challenges we have is trying to define this problem, which I think is why we kind of need to do these more informal types of presentations so we can understand like all the data around the challenge. So when we talk about workforce challenges, I think one of the biggest issues that we have is we know what it feels like in our communities. We know that people are talking about workforce shortages, but what's the larger context of this? And some of the larger context comes from actually the Bureau of Labor Statistics. So if you look at their data online, they're talking about what happens to our population from 2014 to 2060. And what they're basically telling us is that by 2060, they expect our population to grow by 31%. So if we think about our population growing by 31%, that means that our EMS demands, all these kind of things are increasing. But that's pretty far when we talk 2060. How about we talk 2030? So when we estimate and forecast for where we should be with our workforce in 2030, we should have an increased demand by 11%. So the bigger question is if we're going to respond to this increased demand, how do we do it? And that is going to be the crux of what I'm going to talk about today is how do we respond to this increased need that we see that's coming and really actually step up and manage that, because in the frame that we're in right now, this may be too much of a challenge. So the points I'm going to hit today is that we're going to talk about measuring workforce dynamics. We're going to talk about evaluating challenges with entry into the workforce. And I really want to take a little bit of time to define the extent of leaving EMS. So let's start with the basics. So one of the things I did want to highlight is that when we talk about workforce, this isn't something new that the registry has been looking at. We've actually been looking at this since 1998. This has been a whole focus with us, starting with understanding the demography of the EMS by using the LEAD study, which was a longitudinal EMS demographic study. And that progressed for a number of years. And in 2015, we actually made a strong shift where we started looking at our recertification profile and really looking at the population of individuals who are recertifying through the National Registry. And so what are we looking at? We're looking at hundreds of thousands of people. So it's amazing. We're looking at you. We want to understand those EMS clinicians who are recertifying and what do they look like? What are they doing out there? So we can describe this for the federal government and others so we understand what's going on in our communities. So we've been leveraging these data sets to really describe what's happening. And what we know right now is the National Registry of EMT's population, when it comes to those who recertify with us, is 500,000, greater than 500,000 people. Now, when we look at this number, we recognize it's a huge number. It's not all of EMS. And so where does the all of EMS number come from? The closest we have is NREMT in 2020 did an assessment of EMS. And what they found was roughly 900,000 people were EMS clinicians and firing EMS. And the way they did this is they looked at rosters from states and they totaled up all the people who are EMTs, paramedics, AEMTs, and said, okay, here's our EMS workforce. Now, there's problems with that. The people are double counted, all that kind of stuff. But the big crux of it is if there's 900,000 people out there who are functioning as frontline EMS clinicians, and we have 500,000 of them in our data set, we have more than half, almost 60% of the total population that we're looking at when we look at our data. And one of the biggest points that from the registry perspective is we want to build the evidence. So one of the big things that you guys have probably all heard about, or maybe not, is that the nurses got a huge grant of money from the federal government to improve their education, improve what's going on in their workforce. And how did they get there? They got there from building the data and the evidence to make a convincing case that this is the direction that they need the support. And that's where we're at. We're at the point that we need to make this evidence, and we need to make a convincing case that we are hurting, and we can't have these arguments that It's just a shortage in this one spot. It's not everyone. We need to have the discussion that we're hurting as a community and that we need support. And I'm going to try to convince you that that's what the case may be. So what do we know about the current EMS workforce? And one of the things I love to do is I like to keep this really simple. I use the KISS method, where I think about the EMS workforce as everyone who's staying in our workforce, those who are coming in and entering our workforce, and then we have the people who are actually leaving the workforce. So very simple diagram, and you can see it on the screen here, but this kind of gives you the framework of how we can think about this as researchers to describe the problem that we have. So from there, we know there's gaps of knowledge on all different levels, from those who are staying to entry to leaving. And I'm going to try to hit some of those gaps as we go. And what do I mean by these gaps? So like, for the people who are staying, what roles are they serving? What's the proportion in these secondary roles? Entry, what's the impact of attrition? When we're leaving, what's the reasons people leave? These are all those gaps that we want to try to fill with knowledge. So let's start with the basics of talking about entering the workforce. So when someone enters a program, any program, maybe paramedic or EMT, I think at this point we need to call them possible EMS clinicians. I think that's where we start. If once that day comes along where you sign up and say, I'm going to go for this, I am now part of this possible EMS workforce, such that I need to be retained, I need to be trained, and I need to become part of the family. And so they can leave this process of training in a couple different ways. The first one is they do not complete their training program. That's called attrition from their program. They are not completing the training program. They never get to the point that they even get close to satisfying that program. The second one is they do not attain certification, right? So this is actually sitting down for the certification exam and not proving that they are minimally competent. So those are kind of the two big areas that we talk about when we think about those challenges with entering the workforce. Now, we did a really detailed evaluation over the years with COA-EMSP as one of our strong collaborators to start talking about what do paramedic programs look like in the United States. And to do this, we had to build a data set. Right. And so with COA's help, we've actually worked with them specifically to build their a data set of paramedic programs, all of the paramedic programs in the United States. And this is part of their annual review. And so we work together with them every year about looking at their annual review and looking at the data that's coming out and what's happening with our paramedic programs in the United States. And so we started examining the pathway. What does it look like? So on the screen, I'm going to show you a diagram. We know that enrolled in programs is roughly 17,000 people in the United States. And those who are completing the program who are actually eligible for an exam are about 13,500 people. And those who actually pass the exam and show that they're minimally certified is about 11,800. So I've given you these concepts, and you can probably see them on the screen here, but the point is the did not complete training accounted for 22% of the loss of our potential workforce. Why is that so important? That's almost 4,000 people every single year of our national workforce that we're losing. And these are, again, paramedics. Now, when we look at the problem, when we think about the concept of not minimally certified, so this is the concept of actually sitting down, taking the certification exam, and actually passing the certification exam, this was half of that at 11%. So the largest contributor for us not getting people entered in the workforce is actually attrition from the educational program. Lots of challenges here that we need to think about. Now, we looked at this even further, and we started diving into the concepts about why we're having program attrition and what program attrition rates look like. And we actually found that there's a large proportion of EMS paramedic programs who have high attrition rates, meaning greater than 30% of their programs are leaving the EMS field. So that's a huge loss, which is probably a big part of the 22% that we're losing from that group. But the real question is that the only place we see this? So after looking at it with COA-EMSP at the national level, we started looking at it on a state level. And we got one of our collaborators from the Commonwealth of Virginia to help us look at this at the state level. And what did we find? Well, we found a similar rate when it comes to the concept of leaving attrition at the Commonwealth, but we also found another piece, which was scary, that there's a bunch of people who complete their paramedic program and never affiliate with an EMS agency. So now we have another piece where we're losing people.
Where are they going?
Yeah, so where are they going? What are they doing? Maybe they're getting their degree and then doing something else. Maybe they're getting their degree and going to a hospital system. We're losing these people somewhere else that we don't know. So I really want to focus on this next table, which just came up on your screen, which looks at 2018 and 2019 data before the pandemic, so we could have a good understanding of where we were at. And in this, what you see overall program attrition accounts for 26% of the loss of the potential workforce. Unable to gain certification is only 13%, half. But get this, no EMS agency affiliation accounted for another 14%. So by the time we talk about cumulative loss of a workforce, 45% of our potential workforce that we started with in paramedics are gone. Now, we followed this in the Commonwealth of Virginia, but we haven't looked at this across the nation in all different areas. So we have to assume that we have this similar issue and similar challenges across our nation. So that lost workforce is a real challenge for us. Now, when we think about these workforce dynamics, that also brings us to the concept of what's happening with leaving the workforce. So I gave you kind of the entry vision. Let's talk about the other side. So when we think about leaving, this is the true number of EMS clinicians who actually leave our workforce. And so how do we figure this out? This is actually really challenging to measure. So since many people leave in different ways, and I think you guys kind of see this on an everyday basis. Some people leave the workforce for a different career. Some of them leave the workforce, but they keep their card because I want to remember that I'm an EMS clinician. They leave the state and go to another state, or maybe they just leave an agency and hop to another agency. We know that happens like crazy, right? But trying to measure all these aspects and call them leaving is really challenging and trying to understand what that happens. So what we've found is a number of people have tried to look at this question. One of the first ones, which was some great work, qualitative work from AAA, is they looked at turnover rates at the agency level. And this was the first real signpost post-COVID that we are really getting ourselves in trouble. What they did is they looked at 119 EMS agencies. They had a response rate of 17% with only leadership responding. And they found that there was a variability of leaving the workforce from anywhere from 9% to 33% based on the roles that they served. That's a huge variability, but what was really challenging with this data set was they really gave us a great signpost that there's a challenge, but the issue was that it wasn't representing all of our population. So 66% of the data set was private, 33% was public, so we didn't really get as much of that nice, diverse EMS population in this data set, but it really set alarm bells in our community that there is a real problem. So at that point, we need better data which represents our population. We know there's a problem. We know it ranges from 2 to 24% in full-time per agency. We just need better data. And we need population-based data. So it can't just be surveys. We need to actually count heads and know, hey, you left or you stayed. Well, I'm excited to say that's exactly what we did at the National Registry. We took 9 of our states, which have required National Registry recertification as a piece of licensure. So we know that these people are either in the state or not in the state, and we have a count of every single head. It makes that a population-based study. So we looked at each EMS clinician who entered those states, left those states, or stayed, so we can get clear estimates from this process. And our overall goal was first to build a reproducible model. We wanted a method that we can do population-based analyses, reproduce this time and time again so we know what's happening in our workforce. And this way, we can understand what state-by-state variability actually looks like in workforce dynamics. So what do we find? And if you look at the screen, you're going to see some of this. So first, in our certified workforce, we had about 18% of the people leaving the workforce. When you talk about the patient care workforce, as you'd imagine, the patient care workforce was even higher for leaving. That's 23% of the people have left the patient care workforce. Now, this is astounding when we actually take it to the next level and look at the variations per state. And every state has this problem. It wasn't as if one state was doing better than the next state. They all had the same problem. And you can see that in this next figure here, where you can see the variability from state to state to state. What's really shocking is that when we break this down even more and talk about the odds of leaving in 12 months, we find a lot of different components are associated with odds of leaving. Everything from things which were protective, which decreased your odds of leaving, were that you worked a full time, that you are older in our community, so you are very invested and you stayed in our community. The things that hurt us and that you saw that people were leaving more frequently was that you were in an urban setting, that you had higher levels of education. So those who got more educated were more apt to leave our workforce. Those who are any agency type, aside from a fire agency, were more apt to leave our agency. And those who did not work in 911 and worked in other types of like medical transport, they were more apt to leave our workforce. So all of these things are really opening up our mind about the fact that we have a lot of challenges in our workforce. But one thing we did find is that fire has less challenges than other service types. So what we did is we looked at this and tried to understand agency turnover, and we tried to adjust for it like we do like for cardiac arrest. Like, you know, you have for cardiac arrest, we adjust against these Utstein variables like witnessed arrest and all that kind of stuff. We did the same thing for workforce against agency type. And in our adjusted analysis, what we found is that overall EMS turnover is around 16%, but it varies based on agency type. And this figure that we're showing you right now shows this nice curve where you can see that there's certain agencies which have really high rates of leaving, and some of them are really low. So we need to figure out what's happening with these really low people so we can actually understand how to retain people better. Last but not least, we need to think about the reasons people are leaving. Okay, and this is an older study from 2018-19 where we actually looked at the reasons people were leaving, and you can see that desire for pay and benefits, desire for further education, dissatisfaction with management, and desire for a change in career were all big drivers at that time. And one of the things that we realized as we're starting to look at our population is that some of this has really changed since COVID-19. Like the stressors we faced during that time period really had an instability effect on our workforce population. That's just the reality. And I know you guys have experienced this, and the data plays out. We reanalyzed and looked at an updated data population of our EMS workforce and the reasons they left after COVID-19. And we found our previous leaders were no longer the real leaders. Our current leaders were stress and COVID-19. Those were the main reasons people were leaving the EMS field. And so you can see that there's a whole new dynamic that's going on in our workforce. That means also that we need to start thinking about different dynamics to retain. So one last concept that I want to put out there for you guys is to really put this all into context. Is in 2015, Remley Crow, who was our PhD fellow at the time, did a great work looking at the concept of burnout in EMS and did a national evaluation of what burnout looks like in EMS. And during that time period, when we saw that data, we were like, we're concerned. We know that this is scary and we know burnout is high. And we looked at burnout in personal, work-related, and patient-related, and we found the rates were high. What scares me is we redid this work in 2022, and what did we find? We found the rates of burnout actually doubled during this time period. We're at a crucial point in our workforce's history where the stress and strain of all the different things that they're facing, and we don't know exactly what piece is the one that's pushing us too far, but we're getting put in the point that from feedback from our community, they're getting more burned out, and that could be a big player in why people are leaving our workforce. Now, I've been talking the whole time here about all these challenges, and there's a lot that we need to dig into and really piece out to really understand. But I think this gives you an idea of the challenges we have in entry and the challenges we have in leaving. And now it's the question about how do we put all this together.
So what are the solutions then? Are there some things that we need to think more of, think differently about? Certainly we need to study it more, which you and your fellows are doing that.
Yes.
But aside from more studies, what are some potential interventions or solutions?
I think one of the big things that we need to start thinking about is there are clearly identifiable interventions that we have out there. And we have to realize that leaving occurs both at the regional, the state, and the agency level, and that this is dynamic. And that we need to be dynamic of how to address this. We need to understand what's happening in our region and our local level to intervene. And one of the big areas that we can look at is job satisfaction. Job satisfaction is multifactorial, and we have to understand that all these different aspects of the job come into play when we make a decision about why someone's going to leave or stay. And so it's not just odds of leaving is driven by one thing, but one of the crazy things is when we added leaving the job and how satisfied they are to all of our models, it broke the models. And it was something which is intervenable, and it was the biggest contributor to people's odds of leaving. If you're dissatisfied, you're out the door. Go figure. It makes sense. Water is indeed wet. But the thing is that we need to think about how we can look at this. And so what we're doing right now is we're using a validated survey. It's the job satisfaction survey from Spectre, which they've used in a number of different other fields to look at this question. But the cool part is it looks at 9 different dimensions of satisfaction: pay, promotions, supervision, contingency, rewards. You can see all of them here on the screen, but we're looking at all these to understand. And we got almost 40,000 responses from EMS clinicians to tell us what they think about job satisfaction. And what we found was the odds of leaving was totally related with job satisfaction. And here's the scary thing. It was stepwise, that the more satisfied you are in your EMS job, the less likely you're about to leave. It's completely protective. So we need to make sure that we focus on the satisfaction of our EMS clinicians in their jobs and think about ways to make that happen. This is satisfaction is dramatically protective, and that is a target we need to go into. One of the other things we need to think about is our organizational culture. And your culture could be anything from a market where you're competing, or the vast majority are like a mixed bag. And one of the things we do know is that the type of culture you have affects where people leave. If you are in a family environment, like a clan culture, where you might see that in like a fire department or something like that, where you are very family oriented, you're tight knit, you're supporting each other, the odds of leaving are low compared to those who are more competitive types of environment, like market or those who have lots of hierarchies, right? Like almost like a militaristic a group. And so we need to think about how this culture looks and what is our agency's culture look. You can't just figure it out by looking at people. You have to ask the questions and understand these things. Again, culture is one of those things that is intervenable and that we can work on. The last point I want to put out there is we need to think about how we can get better data. And one of the things that I know you guys have probably heard about at some point is that if we had a unique national ID for every EMS clinician, we could do so much to define what the future is, and we could make rigorous evaluations of the data using this kind of national ID. And so what kind of stuff could we do? We could evaluate educational outcomes for all certification levels. We could look at workforce dynamics for every state and nationally. We could design interventions for retention and see if they work. We could geospatially map where EMS distributions are in the United States. And then we could even do modeling of disasters, put a disaster in this place and computer image what happens to EMS and how we respond to these areas. It is critical for us to have that quality of data for preparedness for disasters, as well as understanding what we need to do for our EMS workforce.
And we do have the National EMS ID right now at the National Registry. So that's the good thing. If every EMS clinician who is certified and or is part of the EMS Compact has a National EMS ID number assigned to them.
Yep, exactly. And so it's really easy for us to start collecting this data. We just need everyone to get on board so that we can collect this data and get there. So I guess where I want to wrap this up is I've given you lots of different things to think about. We have entry problems, we have leaving problems, but we have solutions. And now it's the time for us to invest in our workforce and start thinking about how we can leverage these potential solutions and get to the point that we actually start retaining our workforce, because we are not going to make that increase of 11% by 2030 or even more by 2060 if we don't get behind this.
Well, Ash, I really appreciate certainly spending time today with this episode, but equally important for the dedication that you and your team has as far as the research team on better understanding our workforce and putting it into simple, understandable challenges. They're not simple challenges, but simple graphics to illustrate the challenges we're facing. So thank you for what you do for the National Registry and for the National EMS community. It's
our pleasure. This is a labor of love, and it's great that our research team has EMS clinicians who are working our team, and they're the ones who are the people who are trying to voice all the frustrations that you guys have out there, and we just need to take those frustrations and make them into research, and that's what we're trying to do.
And to find out more about our research program, you can visit our website at nrmt.org. Also, anywhere else folks can go to find out some more?
Yeah, so a lot of these comments and thoughts, we actually published a paper in GEMS. We were asked to send this over. Our first author was Rebecca Cash. Jose Cabañas from NMSP, who is the president there, was an author. The paper is called Unveiling the National EMS Workforce Crisis, Common Questions and Research Insights. And in that paper, we talk about a lot of these issues.
Excellent. All right. Again, thank you, Ash, for joining us. And thank you for joining us as well. And as always, stay safe. Thank you for joining us for this episode. If you wouldn't mind, please click the like and subscribe buttons, as well as the notifications so you can get notifications of upcoming episodes. Also, for the latest and greatest happenings of the National Registry, feel free to go to nremt.org. Thank you very much. And again, stay safe.